I think, Chairman, the problem here is there's a lack of joined-up thinking right across the board in relation to it. And there's no effort being made to actually try and make routes viable. And I accept the point that Ms Graham has made earlier on that, look, the PSO budget has been cut, and it has been cut, and we do need more money put into that. But to give you an example of what I'm talking about, last week, Bus Éireann announced it was either use it or lose it in relation to Route 21, the Westport service, Westport Athlone service. The same week, the Department of Social Protection announced that it was closing its community welfare clinic in Ballinlaw, and people would now have to access that service in Castlereagh. So at the time that Bus Éireann are announcing that they're removing the transport service, or potentially moving the transport service from Ballinlaw into Castlereagh, social welfare, who have their own separate budget, are now closing down the clinic there. People that have to go in and badly need to get into the Community Welfare Office clinic in Castlereagh will have to pay a taxi to come in, which will have to be funded by the Exchequer, where there was a transport service in place. And I think it's hugely frustrating, and we have the same thing in relation to Rooski, where the Community Welfare Service is now being withdrawn at the end of the month there. As you know, Bus Éireann withdrew the Rooski to Drummond bus service last year or the year before, and now the Community Welfare Clinic is being removed out of Rooski, go to Drummond. So the point I'm trying to make here is there's a lack of joined-up thinking between all of the state agencies involved here. And I think you, Ms Graham, need to start banging heads together and try and thrash out some of these issues. And I accept, you know, there is the commercial test, and Bus Éireann in relation to the expressway route have to look at the commercial aspects in relation to it. I know there has been huge changes because of the motorways being developed, and that has an impact in relation to your service. But I'll give you another example. Knock Airport has dramatically increased its passenger numbers. 1.1 million passengers went through Knock Airport last year. And yet, Bus Éireann is looking at reducing services into Knock Airport, not expanding them. So while we have a great service into Dublin and expanded services by Bus Éireann into Dublin Airport, as far as Knock Airport is concerned, we're actually withdrawing services from it rather than trying to enhance them. Another example. The County Hospital in Roscommon closed back in 2011. Can I ask, what discussions have taken place to date with the HSE in relation to that? Because people from County Roscommon now have to go for hospital appointments to Castlebar, to Portiuncula and to Galway. Now, if you're going to Galway, you will get to Galway for an afternoon appointment, but you won't get home from Galway after having it. If you go to Castlebar, you will get a bus to Castlebar to get an afternoon appointment, but you won't get home from Castlebar after you've had that appointment. You will get to Portiuncula, all right, but to get a late morning appointment, but you have to wait till 4:30 in the afternoon to get the return service back to any part of County Roscommon. So what I want to know, Ms Graham, what discussions have the National Transport Authority had with the HSE to facilitate transport to clinics and from clinics, and the timing of those clinics? For example, has the staff in each of those hospitals that are making those appointments, have they been given a copy of that timetable booklet that you've produced, so that they can actually schedule appointments, particularly for older people, so they can actually get there by accessing public transport, rather than having to pay 150 or 200 euro for a taxi to get to that service? And does it not make far more sense, rather than paying out 200 euro for a taxi, some of which is paid for by the state, and providing a transport service that ensures that people get to appointments in the first place, reduces the do not show, reduces the number of people and speeds up their access to get treatment, reduces their admissions to A&E and the chaos that that's causing in A&E, reduces the pressure on the ambulance service and the financial impact that that has across the operation of our health service. And what's frustrating for me is that for the last 15-20 years, we've all been talking about the need to have joined up thinking between all of the agencies, both state and community, about linking up service, about maximising the use of services. In relation to the suggestion that I've made regarding the HSE, for the last 15 years I've heard it, that there's going to be coordination between the transport agencies and the HSE regarding appointments, but nothing seems to be happening, and all we seem to see is more services being reduced, and unless you're going to Dublin, forget about it. There's an odd service as well to the likes of Galway and Sligo, but if you're going anywhere else, just forget about it in relation to providing a transport service, because it won't happen. It's not commercially viable, even though the vast majority of services in the Greater Dublin area aren't commercially viable. They'll continue to go ahead, but in rural Ireland, forget about it. Thank you, Chairman.
Okay. It goes to Deputies McNamara's and Deputy Naughten's. Please.
I'll just start with the Deputy Naughten's question about the PSO. I don't have the figure about how the PSO is split between the Greater Dublin area and what's spent outside the GDA. Just that I have the figure for Bus Éireann as a whole, which would be just over 30 million. But we can get that split at a later stage. I just don't have the figure here at the moment.
It's more than a quarter.
Well, I can't comment on that at the moment. And the comment was made that no effort is being made to make the routes more viable. I wouldn't agree with that, because we are constantly working, certainly on the PSO side, to make the services more efficient and effective. And that's been the work that we've been doing for the last 5 years in partnership with Bus Éireann, to try and make more out of the subsidy that we get and more out of the resources that they have to hand. And that has been very successful certainly in the regional cities, where the revenue and passenger numbers has grown as a result of the changes that we've made. Yes, we've got to do more in rural areas. We recognise that. We do need to look more now at making those services more efficient, and to provide the services that you say to local hospitals, and to improve those and the integration. The work, I think, has to happen on the ground locally in terms of trying to make those demands and meet those demands for services. We do, and the transport coordination units, which were formerly the rural transport groups, did try and make contacts with the HSE and their local HSE services, and they've been successful in some places, some not so successful. But we will continue to push that the services that are being provided in rural Ireland also meet the demands in relation to HSE services. And yes, you're right, there hasn't been this level of integration. It's going to take a while to get that level of integration, but we do want to work in partnership with the HSE.
When did the National Transport Authority last meet with the HSE on this specific issue?
Me personally, I would have met with the HSE in terms of trying to procure services together, so that would have been about 6 months, a year ago.
But in relation to hospital appointments, that issue, rather than procuring services?
Well, we haven't met the HSE directly in relation to that.
Would it not be a good idea maybe to do that?
Well, I still feel that the people that would be best placed to do that on our behalf, as our agents, are the transport coordination units, because they know what the local demands are and what services can be delivered. And we feel that that's the area where we should get that connection. So
continue to do it on a piecemeal approach, Roscommon, Galway, Mayo,
but the
Clare,
HSE
contact Westmeath, contact GUH separately, try and arrange a meeting with management, rather than the National Transport Authority assisting in actually spearheading that. The same in the other hospitals across the country, because it won't be viable running a bus from County Roscommon into appointments in Galway, but it would be viable for running it from maybe some parts of East Mayo through Roscommon into Westmeath and on into rural County Galway and into Galway City to meet those appointments. That type of coordination can only happen at a national level. It can't happen on a piecemeal approach on a county level and people trying to go and get a service up and running. That won't happen.
But the way the HSE is also organised is on a regional level as well.
No, it's not. No. not for the acute hospital services, not for outpatient appointments. Yes, in relation to for community appointments, yes, but the big issue is not community appointments getting into the public health nurse. People can manage that. The problem is when they have to go to Galway and fork out 150 or 200 euro to get to that appointment, and where the appointment is given to them at 9 o'clock in the morning, instead of actually giving it to them at half 11 or 12 o'clock in the day, where they could possibly get it through the transport service. That's the point I'm trying to make.
I understand the point you're trying to make, and what we try and do in terms of looking at services is try and meet the demands, and that includes the demands in terms of going to hospitals. If we can meet those demands with the general services, the kind of stage carriage services that are provided under contract by Bus Éireann, that's the service that we need to look at, and we will look, and we would generally know the places where people want to go to in terms of hospital appointments. And if we can provide that service, and it means changing the service, our services to meet that demand, yes, we will look at that. But we do need the information coming from the individual kind of customers. We have tended to use the transport coordination units to get that demand. If we can more effectively get that directly from the HSE, we will look to see can we get it.
You're putting the cart before the horse here. The HSE at a press of a button can tell you how many patients from County Roscommon attend clinics any particular week in Galway. Asking the local coordinator to try and gather that information together, they cannot do that as easily as you can do it as a national authority, going to each of the hospital groups. There's only a handful of them around the country, and this is the fundamental problem. Everything is being pushed down, deal with it at local level, let the communities come up with something and we'll assist you in relation to it. You're a national transport authority. You need to grab the bull by the horns in relation to this issue. It's been talked about for long enough. I'm sick of coming into these committees hearing it going on and we're going to look at it and it's going to be from the ground up. This is something that can be done from the top down, and I'm asking you now, as a result of this meeting, to arrange that meeting with each of the hospital groups and actually start that coordination from the top down. Get the data in relation to the number of appointments from the geographical locations within their catchment and see how services can be tweaked and appointments can be tweaked to facilitate the maximisation of the use of public transport.
And if the HSE can make that information available to us in order to help us to plan that services, of course we will look for that information. And certainly, yes, I can give a commitment that we would look for that information if that is available. But I don't know whether that information is available.
Just a few things. I'll do them reverse if you don't mind. Deputy Naughten first. On Knock Airport, that's certainly one of the areas that we're targeting for this season to see if we can make a move on that. We've had this use it, don't lose it campaign since last September, and we also ran this year, we run a national seat sale on the expressway network and we sold 22,000 seats. Unfortunately on that, only 8 seats were sold on Route 21. So I think for all of us to make sure that the people use the products that are there before they disappear, I think that's incumbent on us all as well, okay?
Provide the service and we'll see how it goes. It's a very haphazard service into Knock Airport at the moment.
Well, I think that the north-south access would be much more successful and much more on its
Well, 16% of passengers going into Knock Airport come from County Roscommon. Yeah. The north-south access is no good to them.
Yeah. Just on the Knock Airport thing, I mean, and it's maybe in relation to what's been said about HSE as well, what kind of coordination do you have in we'll say the Knock Airport one with the flight schedules and so on? Because I've seen 20 or 30 people getting onto buses at Knock Airport at particular times. In other words, is it maximised? Is it maximised exactly in relation to the flight times of
and again, the Knock Airport, I'm sure, would be quite happy to give you the data in relation to where the passengers are coming from as well.
Well, we would meet with Knock Airport regularly, the regional manager over there, Rory Lee, you know him yourself, and we'd meet regularly. As I say, we have and we've had increased passenger our bus services on that, and the demand hasn't been there. We are looking at it again over the season, and we will talk to Knock Airport. But on that as well, even in this, we have grown the expressway revenue by 6 to 7%. I know it's no good to rural Ireland, but we've been very successful in the marketing of what we do around Ireland. It doesn't do much for rural Ireland, I understand that, but we have been successful. That growth rate would be as high as anywhere in Europe.